Hello and welcome back. This video now we're going to cover kind of a laundry list I've got over here of diseases that are associated either with an inflammatory response with the skin or a hypersensitivity or an autoimmune disease associated with the skin. Okay, so seborrheic dermatitis will be the first one that we'll cover, and next we'll go over psoriasis. These two are chronic inflammatory responses. So seborrheic dermatitis, you may be more familiar with the term cradle cap in infants. So the skin on the scalp tends to get kind of flaky. This also can occur in adults. And in adults, it's dandruff. Okay. Treatment for seborrheic dermatitis, typically mild detergent soap to clean up the area. It's not an allergy. It's not a result of an individual being unclean or not bathing, although the treatment does tend to be mild soap and detergent, and that's just kind of to remove the skin layers that are flaking off. All right. If seborrheic dermatitis occurs in areas associated with the face, because it can also occur with along the eyebrows, there can be some corticosteroids that are given to reduce the inflammation. But what happens with seborrheic, what's inflamed in this case is the sebaceous gland associated with the skin. So the gland that produces oil. That's what results in seborrheic dermatitis. As skin conditions go, not fatal. Nobody's ever died from dandruff, all right? But specialized medicated shampoos can relieve that flakiness that goes along with it, okay? Psoriasis is also a chronic inflammation, but with psoriasis, there's a genetic component associated with psoriasis. And with psoriasis, it's actually multigenic, meaning there are multiple genes that are needed to result in the disease condition. And what happens with individuals who have psoriasis, they get patches on their skin that start to look kind of silverishly, or whitish or discolored. And with psoriasis, it's one of those things, it's not contagious. It's not caused by an infection, but it doesn't look pretty. So it tends to cause some issues with individuals as far as confidence when you've got large outbreaks of skin that don't look normal, because the skin is the first system that you see associated with an individual. Again, with psoriasis, because it's chronic inflammation, and I'll kind of loop these two off here with my squeaky blue marker. It's a chronic inflammatory event in the skin that results in it, okay? There's not a cure for psoriasis. It's treatable, though. There are some medications that can be given, like corticosteroids. You can increase vitamin D, which helps maintain skin. Sometimes UV treatment will help with psoriasis, depending on the individual. But there are some medications like methotrexate that are given. You may have seen commercials on TV for psoriasis and methotrexate. That's commonly the medication that's given associated with it. No, these two are an inflammatory response, okay? Eczema and contact dermatitis, as well as vasculitis. Now, these three, we're getting into hypersensitivities. So you want to revisit that chapter on hypersensitivities related to each of these, okay? Eczema is a type 1 type of hypersensitivity, okay? It's an allergy, essentially, All right, because remember it was IgE that was involved in the type 1 hypersensitivities. Most cases of eczema are associated with young kids, typically under the age of 5. And typically with eczema, the biggest symptom associated with that is the itchiness of the skin. So kids especially are bad at not scratching. So what you end up happening with eczema would be the primary lesion associated with this skin disorder, but you can have secondary lesions that result from eczema because of the scratching that occurs associated with the itchiness. Okay. Now, I say it's primarily children. It can persist into young adulthood or adulthood as well. But typically what you have are kind of oozing, crusting papules on the skin. Face and eyelids are not uncommon for eczema, especially in infants. Children, the eczema will progress, the skin will thicken a little bit, and that thickened skin then can take on some other characteristics that are not normal associated with the skin. Okay, very common wrist, neck for eczema as well. All right. As you get older, again, if the eczema continues, the skin will continue to thicken. And when the skin starts to thicken, it starts to get a little scaly. So you get bits that come off associated with it. All right. So eczema is going to be one of our hypersensitivities. It's a type 1 hypersensitivity. All right. Contact dermatitis, I'm going to do a squiggly here because I've got space to write, is going to be a type 4 hypersensitivity. So that contact dermatitis, now we're talking about activating the acquired immune response. Remember with type 4 hypersensitivities, these are going to be T-cell moderated. So type 4 sensitivities, when we went over type 4 sensitivities, hypersensitivities, I went over and I had some pictures of poison ivy. So poison ivy is an example of a contact dermatitis. You come in contact with the leaf of the plant, and that causes irritation on the skin and results in the immune response associated with the hypersensitivity. Okay? There are things other than poison ivy that can result in contact dermatitis. Contact dermatitis can also result from things like laundry detergent, from metals like nickel. Formaldehyde can be something else that can contribute to contact dermatitis. Basically, the skin is reacting to something that it comes in contact with, all right? And it's a type 4 hypersensitivity, all right? Vasculitis is our last hypersensitivity. Vasculitis is going to be a type 3 hypersensitivity. So remember the difference between our type 2 and type 3 hypersensitivities. Type 3 hypersensitivities, you get the antigens, the antibodies, complexes being lodged in a tissue. So with vasculitis, the tissue where the complex is being embedded is the skin. All right. Skin and or with it being vasculitis. Blood vessels are another place where you can have the antigen-antibody complex precipitate out and cause trouble. Okay. Typically, vasculitis, the type 3 hypersensitivity, is associated with drug allergies, but there can be other reasons for that to occur. Typically, with the type 3 hypersensitivity, the treatment on that is going to be corticosteroids, topical or systemic. Okay? And with corticosteroids, remember what you're doing, you're reducing that inflammatory response. So when you've got something associated with inflammation or hypersensitivities, corticosteroids are your typical treatment course for that, all right? Typically a short-term course with that. And with the hypersensitivities, the corticosteroids are only given when it becomes very severe, all right? Because typically, again, stress can be one of the things that can contribute to skin conditions like this, all right? So seborrheic dermatitis, psoriasis, eczema, contact dermatitis, vasculitis. Last one that we've got is vitiligo, all right? Vitiligo is an autoimmune disease. And I like the pink, but it doesn't want to write, so we'll go with blue. How about that? With vitiligo, the cell that's attacked is the melanocyte, all right? So with vitiligo, this particular disease process tends to be more easily seen in individuals who have pigmented skin. So what it does is it attacks the melanocyte within the skin, kills off the melanocyte. The melanocyte's what's responsible for producing melanin within the skin. The melanin is the pigment that gives your skin its color. So if you have a darker skin color, you've got more melanin or more melanocytes. And if you have vitiligo, your immune system starts attacking those melanocytes. If you stop making pigment, you're going to stop putting color in. So individuals who have vitiligo, especially if they have very dark skin, it's very striking because you'll see patches of lighter skin among the darker skin. Okay? Typically with vitiligo, it's fairly sudden as far as onset. It can be triggered by things like pernicious anemia that we covered in class. With that pernicious anemia, that was the vitamin B12 deficiency that we talked about in a previous chapter. That can be something that triggers vitiligo. Thyroid issues are another that can trigger vitiligo from happening, okay? The thing with vitiligo is the individual has to be a lot more careful when they go out into the sun because they now no longer are making that melanin that helps protect them from UV light. So individuals with vitiligo, much more prone to sunburn, and also then, due to the sunburn, much more prone to skin cancers because you don't have that protection associated with the melanin, okay? Again, this is one that typically does not have a treatment. You can use makeups to cover the skin discoloration. There are also individuals who go around and they just have two different colors associated with their skin. It's very striking, but there isn't a treatment per se for vitiligo because it's an autoimmune disease. The immune system is attacking the melanocytes. Hopefully this all made sense. I know it's kind of a long laundry list on this one. I apologize for that. But these are the inflammatory, hypersensitivity, autoimmune diseases I want you to know for the skin. If you have any questions, please let me know.